And namaskar everyone. I'm Divya, your host, and welcome to today's live session. We are live on Facebook, Instagram, Twitter, YouTube, LinkedIn. So hop on your favorite social media and let us know your doubts in the comment section. In today's session, we are going to explore about atrial fibrillation, their causes, symptoms, and treatments for it with our expert Dr. Umesh Sharma. Dr. Umesh Sharma is a consultant with the Department of Hospital Internal Medicine and an assistant professor of medicine at the Mayo Clinic College of Medicine. So, without any further ado, let's welcome Dr. Umesh. Hello, Dr. Umesh. How are you doing this evening?
I'm doing good, Divya. Thank you so much, and I want to thank Geek Global Doctors for this opportunity to express my views on atrial fibrillation. Thank you.
That's great. Okay, without any delay, Doctor, should we dive into the session?
Sure.
Yeah. So, as we will be exploring about atrial fibrillation, so my first question is, what is atrial fibrillation?
So I'm gonna start with the basics. So as you know, a heart has four chambers, two atria, the one on top, and two ventricles, the one at the bottom. So normally, blood comes into the atria, goes to the ventricles to pump out. And there's a conduction system or cable system in the heart, which start with a natural heart pacemaker called sinoatrial node. It's at the junction of right atrium and a blood vessel called superior vena cava. So impulses start from there, go to atrioventricular node. There's like a little nodal connection between the atrial and ventricle, and then the rest of the ventricles. So normally the conduction flows top to bottom. In some cases, you may have extra stimuli or extra parts of the heart that may act as triggers and send extra impulses. So the top part of the atria starts going crazy and starts beating really, really fast. And consequently, some of those signals get transmitted to the ventricles through the atrioventricular node, and the ventricles, the low part, starts contracting fast. So consequently, your heart goes really, really fast and irregular. This irregular and fast, typically fast rate is called atrial fibrillation. So basically, the atria fibrillate instead of working synchronously, they just go crazy and don't do a good job. So that's in short what's atrial fibrillation.
Okay. So, Dr. Mesh, what are the signs and symptoms of this atrial fibrillation?
So you can have a spectrum of signs and symptoms from being asymptomatic, that somebody is walking, talking with no symptoms, completely normal, to somebody in complete shock. So huge spectrum. Typically, what happens is as your heart rate goes fast and your heart goes really crazy, it has trouble filling in with blood. When less blood fills in, less blood gets pumped out. That's one issue. Sometimes, if people have long-standing atrial fibrillation, the heart may get weaker and you get heart failure. All those things can cause symptoms as well. Typically, the initial symptoms are skip beat, palpitations, like you feel aware of your heartbeat and heart is racing. You may have irregular pulse. Sometimes you have symptoms of heart failure. You may have shortness of breath. Sometimes chest pain, dizziness. You may pass out. And obviously, the one of the most common symptoms you worry about is a stroke, because if the heart upper chambers don't beat regularly, blood can clot, and the heart can throw up a clot, which goes to your brain, and you get a kind of stroke. So those are the symptoms, kind of, as I said, a spectrum of possibilities of symptoms.
Dr. Mesh, you explained the details for signs and symptoms of atrial fibrillation in great depth. So, can you please explain what exactly happens during atrial fibrillation?
So usually, what typically happens is the heart, heart's function is to supply blood to the rest of the body, including brain, your muscles, and lungs. So if your heart has trouble filling in with blood and has trouble pumping out that blood, you tend to have symptoms and signs of hypoperfusion, or poor blood supply to vital organs like your lungs, your brain, and the rest of the body. And then these typically cause symptoms. And in cases where you have blood clotting in the heart, one of the clots can go up to your brain and get signs and symptoms of stroke. And that's one of the biggest complication is of the treatment typically is geared towards kind of slowing down your heart and especially preventing the risk of stroke.
Okay, that's wonderful to know. So, Dr. Mesh, like you explained, like what is atrial fibrillation, what are the signs and symptoms. So, like, what are the causes of this atrial fibrillation?
So usually, if you look at the anatomy, what happens is in the heart, you may have extra area that sends signals, usually around the pulmonary veins, which has extra triggers. In normal people, that should not be a problem. But if you're under stress, if you have underlying medical issues like underlying heart disease, a valve being narrow, sometimes people with, especially in India and other continents, people have rheumatic heart disease with narrowing of valves, which can cause your left atrium to get bigger. You may have sometimes people have high blood pressure, lung problems, stress, as I mentioned during pneumonia, like surgery or infection like pneumonia, previous heart problems, or as we age, sometimes our conduction system gets weaker, and you may have sick sinus syndrome with irregular heart rate as well. Medical issues like hyperactive thyroid and other metabolic imbalances can cause it, like sleep apnea. Sometimes people using stimulants, too much smoking with, obviously adding nicotine, alcohol. Nowadays, a lot of people drink energy drinks which are highly caffeinated, can make your heart really irritable. Viral infections. So all these things can make your heart irritable and predispose you for irregular heart rate or atrial fibrillation.
That is a lot of new information about what causes to this condition. So, as you gave the details about signs and symptoms and what causes it, so are there any types of atrial fibrillation?
Typically, based on how long somebody has been in atrial fibrillation and whether they're responsive or not for treatment, you get classifications like paroxysmal or occasional. So once in a while, somebody goes in regular heart rhythm, and within like a minute or so, they revert back to a regular rhythm. So we call that paroxysmal or transient. Sometimes people are persistent, or sometimes the heart rhythm stays irregular and doesn't go back to a normal rhythm. Uh, that's persistent. Long standing would be the atrial fibrillation lasts longer, typically around 12 months or so. And permanent is we've tried everything, and then the heart never comes back to a normal rhythm. And we call that persistent or permanent atrial fibrillation, where you cannot restore a normal sinus or regular heart rhythm.
Okay. So there are two types of atrial fibrillation, as you explained.
Correct.
Yeah, great to know that. So before moving further, let me tell you to all the viewers that eGlobal Doctors is providing diet consultation. We have variety of featured categories as diabetes remission, detox program, weight loss, and many more. So you can register with us today at eglobalDoctors.com and book your appointment to get a nutrition coaching. So, Dr. Umesh, as we discussed about the types, causes, and symptoms, and like what is atrial fibrillation? So, I wanted to ask what complications can occur in atrial fibrillation?
So the typical complications are usually the main thing we worry about is stroke. With blood clotting in the heart, and one of the clot gets thrown up to your brain. That's number one. Symptoms of hypoperfusion or poor circulation, including dizziness, shortness of breath. Sometimes if your heart is going really fast for too long, the heart gets under a lot of stress and overwork and tends to fail. We call that heart failure. And some symptoms of heart failure would be, you gain a lot of weight, you have trouble breathing, swelling on your legs, and you cannot lie down. You have to sit up with a bunch of pillows and sleep with a bunch of pillows. We call that congestive heart failure. Sometimes you may have frank shock, where your blood pressure drops to below 90 or 60, and when lower, your heart is not able to keep up with the blood circulation. So these are typical symptoms of atrial fibrillation, or complications rather of atrial fibrillation.
Okay, so like atrial fibrillation can cause complications like stroke and heart failure, which is a
Correct.
serious condition. Okay, so like you explained about the complications. So how like someone can prevent this? What are the types of prevention we can do for it?
So typically, uh, the main prevention is better than cure, as we all know it. So the bottom line is take good care of yourself, right? Managing a healthy lifestyle, including weight management, dietary intake, limit alcoholic intake, caffeinated drinks, energy drinks, smoking, those kind of things. Stress is a big deal. managing stress with meditation, yoga, what have you, eating heart healthy foods, especially foods that are low in saturated fats and solid fats, eating more plant-based and grain-based, whole grain-based diet, less meat in particular, regular exercising, uh, keeping blood pressure, cholesterol under control. And if you get diagnosed with atrial fibrillation, make sure you get follow-up care with a specialist and staying on top of your regular clinic appointments and medication as well.
Okay, so we need to focus on our like correct lifestyle changes. Yeah. So, Dr. Mesh, thank you for providing like how we can prevent this atrial fibrillation. So, how atrial fibrillation is diagnosed?
So typically, you want a way where you can check the rhythm. So the typically rhythm is checked by electrocardiogram, where you hook up different leads to somebody's heart and you check the heart rhythm, and you see if the heart rhythm is regular or irregular. Sometimes fast, slow, fast, slow. If somebody's in atrial fibrillation and they say they have trouble breathing, feel dizzy, check the pulse. Typically, pulse is irregular. What they say in medical literature is irregularly irregular. There are other ways where we hook somebody up, especially for a transient or paroxysmal atrial fibrillation. You hook them to a Holter monitor, put up a monitor, send them home. The monitor is like an EKG device, which is portable. They can carry on their person, and it records their heart rhythm 24 hours a day. Usually, people get sent on at least 2 days of Holter monitor, and that it may pick up. There's something called event recorder, similar to Holter, but it doesn't continuously record. Only if you feel symptomatic, you have symptoms and feel something, say dizzy or palpitations, you press a button. It starts recording rhythm. That's a Holter monitor. Sometimes you do blood tests, especially if you suspect underlying issues like drug intake or thyroid disorder. We also do echocardiogram to assess if somebody has underlying valvular heart disease or any complications of atrial fibrillation like heart failure, or stress test is also done to rule out any artery disease. So a bunch of tests, but typically it's electrocardiogram. That's the gold standard for diagnosing atrial fibrillation.
Okay, so you mentioned about sometimes it is asymptomatic. So, like how a person can identify, like how he or she can know he have to go to the doctor.
So typically, as I said, if your pulse is irregular, then there's something not right. In fact, it's funny you asked. All these smart watches, a lot of folks have smart watches, smart devices. They tend to pick up irregular heart rhythm. In fact, I admitted somebody, we took care of somebody about a couple of months ago. Their Apple Watch told them they had atrial fibrillation, and that's why they came to the ER. And lo and behold, they actually had atrial fibrillation. So it's amazing some of these smart watches and smart devices can do for you. Like these are called wearable technology, medical technology. So that's one thing. But typically, if you're asymptomatic, uh, we don't really treat you. We just watch you. Unless you have underlying major heart issues or other stuff going on, then obviously after discussion with a specialist, we decide to take next steps.
Okay, that's wonderful, Dr. Umesh. So before hopping to our next question, viewers, eGlobal Doctors is one complete healthcare platform solutions for all your medical related issues and questions. And मजे की बात ये है, you have these services available to you at your fingertips without breaking your bank balance and without driving all in the comfort of your living. So let's back to our topic. So like we discussed about the how it is diagnosed, what are the types. So what are the treatment options for it?
So typically, the goals of treatment are you wanna ideally you wanna reset the heart to regular rhythm from irregular rhythm. You wanna control the heart rate, and obviously prevent blood clots or stroke from happening. So there are different options. One is medications, where you can take medications for slowing the heart rate down or converting the heart into regular rhythm. The other option is therapy, typically electrical therapy or medical therapy, to convert the heart to a regular rhythm called cardioversion. And typically, if these fail, then you may have options like procedures that tend to stop atrial fibrillation and convert somebody into a sinus rhythm. So some of the medications we use are different classes called beta blockers, which typically slow the heart rate down. There's another class of medication called calcium channel blocker, which does the same thing. Another medicine called digoxin, which we typically use in heart failure, especially in atrial fibrillation with heart, which is weaker and pumps less than 30%, is supposed to be beneficial. And there are a bunch of antiarrhythmic medications we can try to use. Typically, the ones we use in the hospital are sotalol and amiodarone, which helps to regulate the heart rhythm and convert it to sinus rhythm. The different kinds of blood thinners are used to prevent blood clots. Namely, in the past, we used to use Coumadin. Now there's something called DOACs or NOACs, direct oral anticoagulants. The ones in the market are Eliquis, Xarelto, and many others. Speaking of electrical cardioversion therapy, is you can do electric cardioversion, especially in an acute setup where somebody's symptomatic, they have low blood pressure, have signs of hypoperfusion like shock, chest pain, trouble breathing. You may want to do a shock where leads are placed in front and back of the heart, and we shock the heart into regular rhythm. So typically, it's the same thing you see in TV where somebody gets a shock, the heart stops for a second and starts resetting and getting back to normal rhythm. That's one that's called cardioversion. Medications can do the same thing. As I mentioned earlier, amiodarone and sotalol, a couple of medications we typically use. And if nothing works, then you obviously have procedures. We have electrophysiology, cardiology specialists. What they do is they put a catheter to the groin or the arm and try to either use hot or cold probes to burn an area, typically around the pulmonary veins, to they map the heart and find out that those loci or focus where extra signals are produced and try to burn them off. Sometimes they do something called a maze procedure or create scar tissue around those areas where, as we know, scar tissue does not conduct electricity. So if you have scar tissue around the area of abnormal conduction, the conduction doesn't go through the scar tissue and tends to stop atrial fibrillation. In rare cases, we do AV node ablation, where the AV, as I mentioned earlier, the atrioventricular node, the conduction gets destroyed, and you put a pacemaker, and that tends to help with atrial fibrillation. So a lot of procedures. In fact, now some of the new ones are where you want to reduce the risk of stroke. There's a part of heart called atria, and there's a part of atria called appendage, where they sometimes staple the appendage or put something in where they block the appendage, so there's no blood clotting in that area of the heart. If blood doesn't clot, you don't get blood clots and no stroke. So a lot of options depending on what works, what doesn't work, and are you a good candidate for blood thinners or not, how old you are. So a lot of variables that go in making decisions. But the point is, many options are available to take care of atrial fibrillation nowadays.
So viewers, if you are suffering from this condition or have its signs and symptoms, there is no need to worry because there are lots of treatment options available as the doctor explained. And you can reach out to Dr. Umesh on eGlobal Doctors if you need any help or guidance regarding the treatment options. So my last question is like, what are the risk factors of atrial fibrillation?
So as I mentioned earlier, usually the risk factors are kind of similar to what predisposes you or the causes of atrial fibrillation. Typically, the older we get, we have a risk of the conduction system kind of in a way degenerating on us. That's a risk factor. Underlying heart disease, somebody especially with valvular heart disease, like mitral stenosis, where one of the valve gets narrow. High blood pressure, especially uncontrolled high blood pressure, is a risk factor. Thyroid disease is a risk factor, along with infections, especially viral inflammation. Inflammation can cause AFib, or if you're underlying pneumonia, or if you're undergoing surgery or stress of it. Drinking alcohol, doing drugs, too much smoking or caffeine, use of stimulants like all the energy drinks, especially if you overdo it, can cause atrial fibrillation. Obesity, sleep apnea is a big risk factor. So is family history or genetics is also a risk factor as well.
Thank you, Dr. Umesh, for providing lots of information about the topic. So, Doctor, can you provide the summary for the topic to our audience who have just joined us?
Sure, absolutely. So the bottom line is atrial fibrillation is where your heart beats irregular and sometimes really fast. Typical symptoms could be anywhere from asymptomatic to feeling palpitations, a little bit of dizziness, feeling aware of your heartbeat, or stroke. The bottom line is you want to control the heart rate, bring it within a narrow range of normalcy, 60 to 90, usually with the help of medications or electric cardioversion, and in rare cases, procedures. Usually, what you want to do is you want to stay healthy, avoid risk factors like smoking, alcohol, caffeine, energy drinks, and eat healthy, stay in an optimal weight, as well as avoid sleep apnea, which is typically a complication of being obese. So just pretty much living a healthy lifestyle and do what you need to do to stay healthy.
Thank you so much, Dr. Umesh. It's always a pleasure to have you in our live sessions. You always bring so much of information. Before wrapping up the session, viewers, are you looking for an expert's second medical opinion for cancer treatment? Well, look no further because eGlobal Doctors is providing access to top oncologists from across the world. If you need any help or guidance from our Dr. Umesh Sharma, you can connect at eglobaldoctors.com. Thank you so much, Doctor. Thank you so much, viewers.
Thank you so much. It's a pleasure, and I appreciate this opportunity. Thank you.
So it's a wrap.